Okay, welcome everyone. I think we might get started. So thank you for joining us for today's webinar for Choosing Wisely Week. My name's Kate Gorman. I'm the Deputy Director at the Healthcare Consumers Association. And as we begin, I'd like to acknowledge that we're hosting this webinar today on the beautiful lands of the Ngunnawal people here in Canberra. I pay my respects to elders past, present and emerging and thank them for their care of our country and their contribution to the life of our city and our region. I warmly welcome Aboriginal and Torres Strait Islander people who are joining us today and pay my respects to the traditional owners of the land where all of our presenters and participants are joining us from today. So just a little bit of housekeeping before we start. Please keep yourself on mute as our presenters speak. That will help them to not have noise interference and help the other participants to listen as well. You can ask questions or share any thoughts or comments you have while the presenters are speaking by typing them into the chat, and we really encourage you to do that. If you have questions as we're going along, we'll bring them up as each presenter finishes. And when you put things in the chat, all of the other participants will be able to see and respond to the things that you add into there. So please use that. So the aim of today, the Choosing Wisely campaign is an international campaign, and at its heart, it's about helping consumers to have good and useful conversations with a doctor, a nurse, maybe a pharmacist, about which tests and procedures might or might not benefit them. It's about learning those questioning skills and the things you can ask to help you navigate your way through the choices we all have in healthcare. We've got 2 speakers today with time for questions after each one. I'm delighted to introduce our first one, Jessica Shepherd, the Choosing Wisely lead at MPS Medicine Wise. Welcome, Jessica, and thanks for joining us today.
Thanks, Kate. Just share my slides. So, can everyone see that? So, hi everyone. I'd just like to start by acknowledging the traditional owners of the land which I'm on today. I'm calling from Dharawal country on the south coast of New South Wales. And as Kate mentioned, I'm the program lead for Choosing Wisely Australia, based at MPS Medicine Wise. So I'm going to talk to you today about a bit about the Choosing Wisely initiative, what its aims are, and also the 5 questions and how we're empowering consumers to ask questions of about their care they're receiving with their health professional. So a bit about Choosing Wisely Australia. So Choosing Wisely is a global campaign which aims to reduce unnecessary tests, treatments and procedures through better conversations with health professionals. So Choosing Wisely Australia was launched by MPS Medicine Wise in 2015. And for those of you who don't know who MPS Medicine Wise is, so we're an evidence-based, not-for-profit organisation who works in the medicines and medical tests area to ensure that consumers and health professionals are informed about the best evidence behind tests and medical procedures. And Choosing Wisely really challenges the notion that more is better when it comes to healthcare. So whilst many treatments, tests and procedures bring benefits to patients, some are actually quite unnecessary and can cause harm. So it's really about sort of having that conversation about and questioning the care that you need. So Choosing Wisely is supported by both health professionals and consumers, which are at the centre of what we do. So we have a number of member colleges and associations in Australia who support the initiative, as well as consumer organisations. So you can see from this slide, these are our 9 consumer members. And Choosing Wisely is underpinned by 6 principles. So the first one being clinician-led. So health professionals are really back the initiative to build trust and emphasising quality of care and harm prevention as opposed to cost savings. Consumer and patient focus, which is what the key focus of this presentation is about today. So really engaging consumers in what we do. Ensuring what we do reflects the best available evidence. It's multi-professional, so It applies to not only consumers, but a range of different health professionals, from doctors to nurses, pharmacists, and other allied health professionals. And we're transparent about what we do in our processes behind what we do as well. So as I said before, there are risks and benefits associated with all test treatments and procedures. And choosing wisely is really about recognising the importance of asking these questions so consumers and patients can be fully informed about their options. Now, whilst some patients and consumers may know the questions they want to ask, they may not always feel confident, or they may not feel like they have permission to ask the health professional of these questions. So we developed this resources called the 5 questions to ask your doctor or other health professional. And it really is to encourage consumers to, or empower them to actually ask those questions when the time is right. So the 5 questions are: do I really need this test, treatment, or procedure? What are the risks involved? What side effects can I expect to experience? Are there any simpler or safer options, so alternative to medication or the test? What happens if I don't do anything? So if I don't take the test, treatment, or procedure right away, will my condition get worse? And what are the costs? So that's not only financial costs, but also emotional costs and costs associated with the time in sort of having that test or procedure done. So the 5 questions have been translated into 13 different languages. So they're all available on our Choosing Wisely website to download. We've recently adapted the principle behind the Choosing Wisely 5 questions into different disease areas. So this is an example of what we've done for managing pain and opioid medicines. We've also done this for patients experiencing lower back pain and heart failure. So this is really to support patients with these conditions to ask the right question of their health professional about the care they're receiving. And so this is Deb Letiker, who's our consumer advocate. So I just wanted to share this quote with you about the 5 questions. So Deb says, the 5 questions are a conversation starter. It gets me thinking about what is it that I really need to ask my health professional about. I may not use all the 5 questions, but it focuses my mind on gathering my thoughts about the things that are bothering me or worrying me. So that just emphasises, the importance of those 5 questions in, sort of understanding what you really need to ask. So as I said before, asking questions isn't always easy for consumers. So they may know what to ask, but they may feel anxious. They may feel like they don't really have permission to ask, or feel unprepared in a consultation. So we've developed a tip sheet, communicating with your healthcare provider, which really prepares you for, before your appointment, during your appointment, what to ask, and it really helps consumers overcome some of the barriers to asking questions about their healthcare options. So this again is available on the Choosing Wisely website, which you can download or print, along with the Choosing Wisely 5 questions. And I recommend consumers look at this before and during their appointments, so they know and can be supported to ask questions. For any consumer advocates, we do have a conversation starter kit. So we developed this in collaboration with the Consumers Health Forum of Australia, and it really is a toolkit to promote better conversations and to raise awareness of choosing wisely. So there's a number of different resources and presentation templates in there that you can use if you're sort of giving any presentation to consumer or consumer groups about choosing wisely. So again, that's available on the Choosing Wisely website. Ways in which you can get involved. So there are a number of ways. So if you're a consumer organisation or a college or a medical association, you can become a member or supporter. So a number of the different medical colleges actually develop recommendations in different disease areas for choosing wisely, which are backed by evidence. We also have a newsletter that you can subscribe to on our website. There's a link on there for you to subscribe. So that contains sort of key activities and some of our stories from both consumers and health services. And again, you can visit our Choosing Wisely website, which has a number of different resources, including the 5 questions, which have been adapted for the different condition areas. And then there's social media as well. So we're on Twitter, Facebook, LinkedIn. And particularly excited to be here today because it is part of Choosing Wisely Week. So this week is Choosing Wisely Week, so which is great timing for the webinar. And in this week, we're encouraging consumers even more so to think about asking those questions to their health professionals, and also showcase any activities related to choosing wisely through things like social media, so we can kind of tweet and share what you're doing. So that was everything from me, but thank you very much for listening, and happy to take any questions.
Thanks, Jessica. Has anybody got a question for Jessica? You can feel free to unmute yourself or raise your hand if you do, and we will put you on. I've got a question for you, Jess. Have you got any thoughts on how people, like what kinds of things people might consider when they are trying to decide what's right for them?
Yeah, so I guess a number of factors sort of come into the shared decision-making process, sort of what might suit their lifestyle, if they've got a medication option versus a non-medication option, do they like taking medication as opposed to, say, receiving therapy or exercise? I think obviously the doctor can always make recommendations about what's best for your condition, but there is obviously lifestyle factors, things like cost and convenience as well, and what really suits your lifestyle best, and things like that to consider.
Yeah, and I guess that's the key point, really, isn't it? Because we're all individuals, and so what might work for one person wouldn't work for another person.
Yeah.
Medications, for example, might have side effects that you wouldn't want to have, so you might choose an exercise or a therapy option if you could, if you knew that you had those choices.
Yes, exactly. And we'd always encourage to have those conversations with your doctor or health professional, so you know what other options are available for your condition or for your care. So you can sort of really assess those options and know what fits you as any really.
And I guess that also means that you've then got to share that personal information and those personal preferences with your doctor or your health professional, so they can understand and make suggestions about the things that might suit you and know why you might make one choice over another choice.
Yes, I think that's really important. Really important to consider and have that as part of the conversation.
And and really for us as consumers, it's about knowing that there are other choices, because sometimes we don't know that. We have something put in front of us that we could do, but we don't know unless we ask that actually there are other things.
Yes, and it gets very confusing because I guess we can go to the internet, we can go to social media, and there's an awful lot of information on there, some of which has some truth, but some that certainly doesn't. So I think, when you are thinking about different options and treatments and tests, the best source of truth really is to have that conversation with your healthcare professional, so you are receiving evidence-based and sort of factual information as well.
Yeah, you do need to get the information from a trustworthy source. And I guess different health professionals have treatments that they would prefer too. So, knowing that they might have the thing that they that they usually suggest in your situation, it might be that you could get a second opinion too if it wasn't a path you wanted to go down.
Yeah, exactly. And we would always encourage people to get a second opinion if they feel that would be
right. Yeah, as do we here at Healthcare Consumers Association. We always say, you've got a right to get a second opinion, and sometimes for whatever reason you're just not on the same wavelength as your healthcare professional, and sometimes it does help to get a different viewpoint.
Exactly.
Now I've got a comment in the chat here, so I'm just going to read this one out. Would Jessica or others care to comment on various screening programs? For example, I've just received a reminder about cervical screening being due, or bowel cancer screening. These and breast screening are designed to be population-wide for our health. Any comments on those kinds of programs?
So I would say, just want to, I guess, raise the importance of participating in those programs. And if you have been invited, I guess, for government screening or by your doctor, it's really important to attend that screening. And that's definitely not something that's considered as unnecessary care, particularly things like cervical screening and bowel cancer screening. That's part of sort of a national program that the government are delivering.
Yeah, and I mean, we always have choices about any kind of medical treatment we have on offer. I guess this is probably a good time to say that in these kind of webinars, what we're talking about here is general rather than personal advice. So, if you have concerns about whether or not you should in particular do a screening, it is best to talk to your doctor about whether that's important for you. Now, I thought I heard somebody about to jump in earlier. Did somebody else have a question?
Can I just ask for a question, please?
Please do.
Yeah, Jessica, thanks for that input. It's quite useful. Just want to know that 5 questions you mentioned when you need to go for a procedure or operation or anything like that. Some doctors may not be able to answer all the questions to your satisfaction. So what do? You normally go to a second opinion or go to another doctor, or take it the face value of that doctor?
I mean, I would hope that doctors could answer those questions. I think if you, you don't feel that you are getting the information that you need from your healthcare provider, you can always go to someone else that might be able to give you that information. But I think most doctors should be able to answer those 5 questions that are using Wisely 5 questions resource. They're pretty sort of standard questions that I think most health professionals should be able to answer.
But just as a general principle, Eswar, and it's a good question, if you ever feel that you're not getting the information you need or the full information, you should always feel like it's your absolute right to go and seek another opinion. We do need to pursue information until we're satisfied that we know what we need to know to make a decision. So if you feel like you're not communicating well with this person, or they're not giving you what you need, it is fine to keep asking, or perhaps find somebody who has more information or can communicate with you better, because health professionals, they're relationships like other relationships, and sometimes we don't have the right one and we need to find somebody who meets our information needs.
Okay, thank you so much.
Now another comment here. Trying to get a second opinion might not go too well with your doctor, so how is the best way to navigate around that diplomatically? Yeah, that's hard, isn't it? Jess, have you got any thoughts on diplomatic conversations with your doctor?
I think, like you say, everybody has the right to a second opinion, and I don't think health professionals should be offended by that, as long as I think you just sort of need to explain your reasoning, and you've got the right, so you certainly shouldn't feel like that's a barrier taking that opinion.
I would hope that egos wouldn't get in the way, but we are humans and they sometimes do. We can't always I would hope that health professionals would understand our need to feel fully informed. I guess the first thing to say, though, is if you leave a consultation and you feel like you're not satisfied, there's no need to tell your doctor particularly that you're going for a second opinion. It is, it's not something you necessarily need to bring up unless you then want to go back to the first one and discuss that opinion. But I think in the end, we need to choose our doctors as people who can live with us doing things like that. I don't think you could ever be blamed for wanting to be fully informed. Okay. So Eswar's asked, how does he get your newsletter? Would that be the resource? Eswar, do you mean the resources that Jessica's talked about with the questions and the translations. Is that what you
Yes.
what you're after? How
Yes.
do people access those, Jess?
So you can get them from the website, but I'm also happy to send around to you, Kate, maybe a link after the webinar if anyone sort of needs the direct link. But if you just go on the Choosing Wisely website, it is at the bottom, subscribe to the newsletter link.
Okay, let's do that. We'll send around some links after this by email, and if Geraldine's feeling fancy, she could drop the link in the chat as well. We'll see how that goes. Okay, and I think just generally when I look at those questions, I think, you know, we here at Healthcare Consumers are always interested in anything that helps us ask better questions, and there are a number of different resources around that you can find. Anything that helps you have those discussions or think about the right questions, even doing things like writing your own question list before you go to an appointment. Really encourage all of those, because questions are where it's at with finding your way through healthcare. Okay, anyone else want to put their hand up for a comment or a question for Jess? There we go. Choosing Wisely. It's dropped into the chat. If you want to click on that for later, you can, but we will send it around as well. Okay then. Well, thanks, Jess. And I'm not guaranteeing that more questions won't come up for you, but in the meantime, we might move on to you, Karen. So our next speaker is Karen Colford. She's a consumer representative with the Healthcare Consumers Association, and she's got a special interest in health literacy and questions. So welcome, Karen.
Hi, thanks very much, Kate, and thanks, Jessica, and welcome everyone to Choosing Wisely Week. I'm here in the ACT with Kate, so also on Ngunnawal country. I'm also on the consumer advisor group with Choosing Wisely, so I have met Jess once before online. So thanks very much for sort of having me here to talk about this. I think it was a couple of years ago when I first came across the Choosing Wisely 5 questions online. And I must say they seemed like very simple questions, so simple that I wondered just how useful that they might be. Would they really make a difference? Would they help at all? And I found myself over a long period of time, I kept thinking about these questions. And then I recalled when I had hurt my back quite badly some years ago after I'd been chopping wood, which was probably not a clever thing to do. And given the level of discomfort I was in, I fully expected when I went to see the doctor that I'd be asked to have x-rays or scans. And so when this didn't happen, I was rather dubious when the doctor said that just wasn't needed. And I must say, I left feeling a little bit ignored and wondering if the doctor had really appreciated just how much discomfort I was in. In other words, I really wasn't feeling entirely confident with the doctor's recommendation, but I didn't feel comfortable or able to express that to him or really ask him why he had recommended what he had. So looking back, I think I could have asked him a lot more questions, but I hadn't. And I think it's as a result of that, I always try to make sure I do ask questions. And I think that the Choosing Wisely 5 questions are a great place to start. And they are important because, as has already been mentioned, we often forget that it's okay to ask questions of our health professionals. And it's really good to know that increasingly doctors are expecting health consumers to ask questions. So I don't think we should ever be afraid to do that. And I think asking questions can provide more than just the answer to the question. I think it actually opens up the opportunity for conversations. And here I mean conversations where both people, the consumer and the health professional, are both comfortable to raise their ideas and their worries and their expectations. And then understanding each person's perspective, you can come to a shared decision about the best way to proceed. So I think having a proper conversation can sometimes lead to revealing information that we may otherwise be reluctant to reveal as a consumer. And one thing I think about is, you know, that question, do I really need this test or treatment? You know, if you're told that you need to go and have an MRI, if you can say, well, do I really need to do this? It might be a way to open the fact that you really are genuinely phobic about having to slide into an MRI machine. And maybe there are ways that this can be addressed, but you might not have been able just to come out and say that. When it comes to simpler and safer options, I think sometimes we assume that a tablet or a procedure is going to be the best way to go, but there are things like appropriately diagnosed back pain, where staying active and keeping on moving can be a real benefit. So can other things like heat packs or cold packs and seeing a physiotherapist. So sometimes tests like x-rays and CT scans can be expensive and time consuming. And if the results aren't likely to help with your treatment, then it's quite a realistic and valid choice to not have those tests. One of the questions is, what are the costs? And I think we're probably all interested in this one. And I think they're talking about monetary costs as well as costs on your time and possibly your emotional, the impact of tests, having tests too. And I think as health consumers, we often don't know what we don't know, obviously. So it's worth asking the simple questions like, what happens if I don't do anything? And an explanation about that can result in you feeling or developing a much better understanding of your condition. And you might just be surprised at what you learn about the condition that you wouldn't have learnt if you hadn't asked that question. And I think all these conversations help a health professional gain a better understanding of their particular consumer's ideas and concerns. And I'm sure that the level of satisfaction that you might have with the doctor's visit can improve dramatically, possibly, just by asking one or two of these questions, or if not all of them, when you go and talk to a doctor. And I was a bit surprised to learn that a Consumer Health Forum survey in 2021 showed 1 in 5 consumers rarely or never felt comfortable asking their doctor or pharmacist or nurse when they needed more information. So I think we can even help our family and friends get more out of their visits with health professionals, just simply by letting them know about the 5 questions and encouraging them to try them out as well. And I think I mentioned that increasingly health professionals are aware of the value of these questions, and some of them may already try to naturally include these questions in conversations they have with you, because Choosing Wisely does encourage health professionals to think about these questions too, and they provide resources to the health professionals. So I'm really convinced that the 5 questions are far more than just simple questions. They can be the key to developing better relationships with our health professionals, and we can learn how to get more information to better understand our own health issues. And I think that just makes the whole health system seem that little bit less scary. So I would say check out the website as well. There's a lot more information on there too. That's about it from me.
Thanks, Karen. So, would you say the job for us then is to get more confident and to, as consumers, to really understand that it's our right to be as fully informed as we can be and as we need to be, and to have that information in ways that we can understand?
Absolutely. I think it is our right, but even putting that aside, I think things just work so much better if you feel as though you can have a conversation with your health provider. And I think that probably works better if you're lucky enough to have a regular GP that you see. If you see a different GP each time, it becomes a little bit more tricky, I guess, which is why perhaps the questions are more important then, to make sure you do ask, because that person, if you're only seeing them once, won't know much about you, or your thoughts and preferences. So asking these questions actually helps bring those sort of concerns to the fore.
So it's about developing that relationship so that they can actually get to know you and what might suit.
Yeah, I think so.
Circumstance.
I think so. And it's so much better to feel comfortable before an appointment when you know you have to go in than to be quite worried and concerned about this might not go well. What if I don't find out everything I need to? So if you can sort of take matters into your own hands, as it were, make sure you ask these questions, I think that's got to be a good thing. And I really do think that there are many doctors now are starting to, they understand this and they do try and incorporate these things into their conversations with you, but not all of them do.
I think so too, and I really agree that it's important to find a doctor or a GP that you can see over time, and that you can build up that relationship with, that can get to know you a bit, and you can sort of see eye to eye on some things. I never had a regular GP until I had kids, because I didn't really need to. But then once I was going back there every month or two with things that were developing, I could see how important it is that over time you and your GP get a relationship happening, so that they can get the context of your life and then suggest things that can work for you.
Yep, that's right. And I think you may not always see eye to eye with your GP, but if you've got, or other health professional, but if you've got a good relationship, you should be able to agree to disagree, essentially, and feel confident to go and seek a second opinion or whatever. And the health professional will respect that because you've already developed some level of a relationship.
And I think a good relationship helps you to question. It helps you to kind of do that in a way that isn't difficult.
Absolutely, absolutely.
Yeah.
Yeah, I think the questions are really, I've changed my view entirely from thinking, oh, these really are a bit simple, to no, these are actually very, very valuable and helpful. If you give them a go, you never know what you might discover.
So here's my question for you then, Karen. What's your best tip for something people can do to make it easier to ask questions in an appointment? If you're struggling a bit with the idea of asking questions, what would you suggest for people?
Have a look at the 5 questions and maybe just choose one in the first instance. And I think the questions probably work better where there's a new diagnosis or a visit to a new health professional. So ask at least one of those questions, then you just might be surprised at just the sort of conversation that will follow as a result of that.
Right. Yeah, that's a good tip. What about you, Jess? Have you got a top tip for people who would like to ask questions but might find it hard? Oh, you're on mute.
Yeah, I think try and be prepared where possible before your appointment. So that may not always be possible because you may find out something during an appointment that you didn't prepare for. So there is that sort of conversation tips guide that you can use to really sort of help you through that process. But I completely agree with Karen as well. It doesn't have to be about answering all those 5 questions. You can really just start with one or whatever's more important to you, or it doesn't necessarily have to be the exact 5 questions. I think I guess what Choosing Wisely really tries to emphasize is the importance of having that conversation and asking questions in the first place. The 5 questions are really just a way in which you can sort of ask those, but they are incredibly valuable as well. So
there's some great ideas there, but actually any question that's on your mind is a good one to start with, really. Anything that helps you get more information about the situation you're in is a good one. I've got a comment on the chat here. I'll read it out. I've had a few appointments where I've written down a page of questions and shared that page with the health professional I've been seeing and found this was really positively received. One doctor said it helped them to better map out how to spend their time with me in the appointment to answer the questions and meet the needs I had identified. It seemed to make the appointment go very differently. When I had kept my list of questions to myself. Thank you for that one. Yeah, writing down a few questions is a really good tip. I think that's one of my favourite things, because you always think you're going to remember what's bothering you, the thing you wake up at 2 a.m. wondering about. You think you're going to remember that when you're in the appointment, but it goes very quickly, and then suddenly you've in the car afterwards going, I forgot to ask that thing that I was really bothered. Fiona said, was the list on paper or did you email it beforehand? I don't know the answer to that, but I would suggest you could do both. If the doctor in the first place at the end of the examination offers proactive choices, read various options available, or what would happen if you do or do not take a test. The onus, in my opinion, should be on the doctor, as it's his duty of care, and not on an anxious or nervous patient who would not even be able to think on medical lines. So I think I see what you're getting at there, Geb, that you'd like the doctor to do, to suggest what they would think would be best because they've got the medical training. Am I right there? I think really
Yes, that's right. Yeah.
Yeah, and look, different people. So in the end, it's our choice to consent to things or not. And we may want to consent and we do want to consent usually based on the best medical advice we can get. So I think it's absolutely fine to say this doctor is an expert, I trust their view, and I'm comfortable to go with what they suggest. That's absolutely, how you can go about it if you want to. Really, it's just about feeling comfortable that you've got all the information you need, I think, in the end. I'm just checking the chat again. That list was a paper one, Fiona. I think you've probably seen that. Fiona makes a list of questions, I assume, in her calendar entry so she knows where to find it and doesn't forget it, and also her scripts. Oh, her doctor asks if there's anything on her list. Well, that's really excellent, I think.
Yep.
Yeah. Yeah. Often time is an issue, isn't it, with questions? You feel like you'd like to ask questions, but you're well aware how busy doctors are and that you might not have enough time. And actually, one of the things we suggest that you could do, if you know you've got a lot of questions and you want to have a chat, is to book a double appointment. So you've booked a bit more time that will give you time to discuss it if you feel like you need to. Now, that often does cost a little bit more to book a double appointment, but you also get a bigger rebate as well. So often for a few extra dollars, you can have a longer chat. And if having that extra time helps you to ask your questions, I think it's quite a good tactic if you can do that.
Yeah. And I think sometimes if your doctor can see you've got a long list of questions, they may even say, look, I understand you've got more questions. We'll continue this on the next time you come in. And if the doctor takes a note of these questions as well, he knows where to start from next time. So it's not a bad thing to make it known that you do have various concerns.
I think so too. And I guess one thing you can do if you've got lots of questions and you're worried you might not get through them is just pick out which ones are the most important ones for you as well, so that you can at least get the things that are really on your mind answered, even if you can't get through all of it. Anyone else got a top tip for getting comfortable asking questions or a good question to ask?
I'll just ask a question.
Yeah, please.
See, I think earlier times we used to have a family doctor who knows about all your history and all that.
Yes.
What's happening, and as you get old, they know all about what has been happening to you. But nowadays, people are moving from one place to another, and every time they go to a new place, they get a new doctor. So that is a sort of a problem as well. So what I think is, when you are old or something, you need someone who cares for you, who knows your background, so that they can treat you better. Yeah. This is my opinion.
Yeah, I agree, Eswa. It's so helpful to have somebody that you've built a relationship up with over time to be a doctor. I know that I've got one that I really like, and I went and she's been with my family since my children were babies, so about 15 years. She knows all about us, and I went to make an appointment the other day only to discover that she has left the practice and I don't know where she's gone. And it makes me want to find her, and I'm going to, and then transfer all of my records. I think she's only gone in Canberra, so I'm going to chase her around Canberra, but I'm very willing to travel to see her because I think that relationship's really important. The idea of having to build up that knowledge with someone else is just exhausting. But yeah, I agree. The doctor relationship is very important. They're the gatekeepers to a whole lot of other medical treatments that you might need. Fiona said it's frustrating when reception staff don't book a long appointment even when you ask for one. I had that recently, yes, with a chronic condition plan. Yeah, that's annoying, isn't it? You didn't have enough time to do what you needed to do. I like the ones that have the online booking, so you can actually choose what length of appointment you want, and you sort of book it yourself. I think it kind of takes some of that human. I mean, it doesn't stop me making a mistake, but it takes one of those steps of human error out. All right. Any more top tips about questioning or experiences people have had? All right. Well, if you are interested in any of the subjects we've discussed today, or you'd like to pursue some of those resources about questions or the Choosing Wisely website, we will send an email out to you all, and you can also find some information on the Canberra Health Literacy website, which I think Geraldine popped in the chat earlier and might come again. The other thing we'd really love from you today, folks, is if you could just spend a minute answering some questions about how this webinar has been for you today and whether you found it useful, because it really helps us to plan our offerings to you and make sure that, you know, what we're presenting for you meets the needs that you have. There's a last comment from Eswai in there saying you go to a medical centre and most of the time you get a new doctor. Yeah, you often do if you go to a centre, don't you? So thank you, everybody. That pretty much finishes things up for us today. If there are no more comments or questions, oh, there is a comment or question. Sorry, I'm just going to read you one last one from Fiona. We got a great GP by chance 2 years ago at our local centre. She moved 6 months later. We followed her and then she stopped working. Okay, and then a new one started. Yeah, yeah, there's the mask problem, isn't there? Yeah, look, I think, you know, it's one of the best things you can do for asking questions is to have a good relationship and an ongoing one with the GP. Not always easy to achieve, but perhaps the tip we'll leave with today. So thanks everyone for joining us, and we'll see you next time. Please do fill out our evaluation for today's webinar if you've got a minute. We really appreciate it. And thank you very much to you, our participants, and our wonderful speakers, Karen and Jess. We really appreciate you being with us today. Bye, everyone.
Bye.
Thank you. Bye.
Thanks.